Have you ever had day after day of episodic cramping belly pain, diarrhea, fatigue, and loss of appetite? Well, you might be suffering from one of a group of lifelong diseases affecting our intestines, collectively called inflammatory bowel diseases. Hello everyone, I'm Dr. Paul Wylie, Medical Director of Preferred Research Partners in Little Rock, Arkansas. Welcome to today's podcast of Hope in the Pipeline. Today on Hope in the Pipeline, we are going to discuss inflammatory bowel disease, or IBD. In fact, I have invited a guest speaker, Dr. Natasa Jensen, a board-certified emergency room specialist and sub-investigator with Preferred Research Partners for the past 6 years, who will introduce herself today and tell you about her background and then give you lots of good information about the various inflammatory bowel disorders. But first, I'm pleased to report that Preferred Research Partners is honored to be currently selected to conduct 2 ongoing clinical trials testing a new medication for the treatment of ulcerative colitis, 1 trial testing a new medication for the treatment of Crohn's disease, as well as trials testing a new medication for the treatment of gastritis and 1 for esophagitis. The principal investigators for these studies are experienced gastroenterologists Dr. John Baber and Dr. Dan Brown, who you can make an appointment with by calling the St. Vincent Infirmary GI Outpatient Clinic at 501-666-0249. I would like now to turn the podcast over to Dr. Jensen so that we can hear what she has to say to us today about inflammatory bowel disorders. Dr. Jensen?
Hi, I'm Dr. Jensen. I am an emergency medicine physician, and I've been practicing emergency medicine for 11 years now in several different states and quite a few hospitals. Today I will talk to you about inflammatory bowel disease, or IBD. Inflammatory bowel disease is an autoimmune disease that affects up to 0.7% of individuals in the United States. The U.S. has one of the highest rates of IBD in the world. IBD can manifest as 2 main diseases. One is Crohn's disease, and the other one is ulcerative colitis. Both of these are autoimmune diseases, which means that your own body's immune system causes an exaggerated immune response that attacks certain organ systems in your body. What causes IBD? The answer is that we are not really sure, but we know that there is a genetic component, which is probably the biggest risk factors. There are also environmental factors that can trigger the disease, like exposure to antibiotics in early life, low fiber diet, and vitamin D deficiency. When we consider inflammatory bowel disease, we often think of digestive system. However, IBD is a systemic disease that can impact other organ systems, including joints, eyes, and even your largest organ, which is your skin. Nevertheless, the digestive system is most commonly involved. As the body's immune system attacks the intestines, the intestinal lining becomes leaky, and bowel contents and bacteria start seeping into the intestinal tissue, causing inflammation, infections, and bleeding. Symptoms of IBD include abdominal pain, diarrhea, bloody stools, nausea, and vomiting. IBD can lead to serious complications, including infections, dehydration, anemia, bowel obstruction, bowel perforation, and eventually even colon cancer. If you're being evaluated for IBD, you will need to see a GI specialist who can perform a colonoscopy and biopsy to confirm the diagnosis. Severe symptoms like dehydration, bleeding, infection will often require hospitalization for treatment and stabilization, and at times might even require surgical intervention. About 1 out of 5 people with IBD each year requires hospitalization, and up to 50% of people with IBD will require bowel surgery during their lifetime. Now let's talk about treatment for IBD. The goal is to treat the disease as early as possible in order to avoid any complications that can be serious or life-threatening. Mild disease is treated with medications that reduce inflammation, like steroids and medication called mesalamine. Moderate disease, however, is also treated with those medications, and then in addition require immunomodulators, which are medications that affect one's immune system. The goal of IBD treatment is to control and minimize the symptoms as much as possible, as well as minimizing any side effects of treatment medications. This is why medical and drug research is important. The goal of research is to find effective therapy that has minimal side effects. We currently have several studies at Preferred Research Partners for people with Crohn's disease and ulcerative colitis. If you have or know someone that has moderate to severe IBD and are interested in participating in research, contact us at Preferred Research Partners.
Thank you, Dr. Jensen, very much for your presentation and for your work with Preferred Research Partners in helping make new medications available to improve health care options available to people throughout the United States. Now I would like to introduce another special podcast guest today, Mr. Erik Guzman. Erik is new to Preferred Research Partners and is currently developing his skills to become a research screener and a research coordinator. But Erik brought with him to Preferred Research Partners a set of unique skills, including his education and occupational background, fluency in Spanish, his Hispanic culture, and his vision for the future of clinical trials, and especially his innate capacity for building personal community connections. For these reasons, Preferred Research Partners is truly blessed to welcome Erik to our staff, and today I want to introduce him and give him the chance to speak about his background, experiences, and his vision for expanding Preferred Research Partners' multicultural outreach program. Erik?
My name is Erik Guzman, and I'm excited to be the newest addition to the team at Preferred Research Partners here in Little Rock. I want to share with you a little bit about my background. I studied at the University of Arkansas in Fayetteville, where I earned my bachelor's degree in psychology. My first introduction to research was in college, where I worked in the lab focused on the implementation of improved treatments for children and their families, basically taking therapies that already work and making sure they're actually used effectively in real-life settings. After I graduated, I spent about 5 years as a mental health paraprofessional in a preschool setting working with very young children who had a background of abuse or neglect, working alongside clinicians to support some of the most vulnerable members of our community while they were still in critical developmental stages. Before coming to PRP, I worked at a neuropsychological clinic for about 6 years alongside neuropsychologists, collecting quantitative electroencephalograms or brainwave scans, educating patients, facilitating biofeedback treatments, and handling some administrative duties there. That experience taught me a lot about brain function, neural networks, and just how your neurophysiology influences the regulation of our central nervous system, and in turn our mental health. One thing that I've always been grateful for is the chance in each of my work experiences to use my skills as a bilingual professional to extend services and information to families who otherwise might not have access. I was born in Torreon, Coahuila, Mexico. I'm a norteño, or a northerner. My family moved to the U.S. when I was about 8 years old, and I grew up in northeast Arkansas before moving to Fayetteville for college. Growing up, my parents instilled in my brothers and me the importance of community and doing what you can to help others. That always has been a big part of who I am, and as a Mexican immigrant myself, I've seen and personally experienced some of the inequities that limited English proficiency communities face, especially in healthcare. It's incredibly important to me that safe and effective healthcare and medications become more accessible for and specific to the Spanish-speaking population, and therefore that we emphasize the importance of recruitment of ethnic diversity in clinical medicational trials. Latinos actually make up about 20% of the U.S. population, and that percentage is growing, yet research shows that less than 8% of clinical trial participants are Latino. Now that's alarming because it means that treatments are being approved for a population that isn't properly represented in the clinical trials themselves. This just doesn't make for good science and could result in safety issues in people from a variety of underrepresented genetic backgrounds. As a clinical research coordinator, I handle the day-to-day activities of trials, ensure protocol compliance and data accuracy, and serve as a liaison between the sponsor, the physician, principal and sub-investigators, and volunteer participants. As the lead for our Preferred Research Partners Community Outreach Program, I want to take a moment for us to think about some of the barriers that keep primarily Spanish-speaking communities from participating in clinical research trials. Some of the biggest challenges that I've noticed center around basic information. Many people don't know what clinical trials even are, or they do not understand how to prioritize their own health. There's also mistrust, not just of research, but of healthcare professionals in general, often because of the lack of culturally appropriate information. Then there's the language barriers, whether that's the absence of bilingual research staff or written consent materials that aren't easy to understand. And on top of that, our community faces practical challenges: transportation, work schedules, childcare needs, and confusion about costs versus compensation in clinical trials. But what I found is that once people understand the purpose of clinical medication trials, how clinical trials work, the rights, the safety measures put in place, and the benefits available, they often are much more open to participation. The challenge for our research site is to communicate effectively and develop an ongoing trustworthy relationship with a variety of ethnicities, helping them realize that the benefits for the community are real and within easy reach. We've already started acting at Preferred Research Partners to be more visible and accessible. I've been meeting with organizations and trusted community leaders in Little Rock, and the response has been very positive. It's been inspiring and energizing. That's our goal, to bring our skills and resources to the table and collaborate with other community and healthcare program leaders. We really want to listen and learn what's most needed right now to promote and maintain healthy communities. Some of what we're working on includes participating in free health screenings, creating ongoing workshops to help the community learn how to take control of their health, identifying resources we can help make available, being physically present at the community events, and sponsoring pop-up health clinics. We're also doing a lot internally. We're building a bilingual and culturally informed team, educating our staff, myself included, on how to better serve our community, creating Spanish language materials for current and upcoming studies, and making sure all participants feel safe, appreciated, and supported. Long term, I want Preferred Research Partners to become a reliable and trusted collaborator in the community by helping to build a healthier, more informed population, reducing inequities in healthcare, and becoming even more of a leader in clinical trials in Arkansas by improving the ethnic representation in our trials. I look forward to partnering with you in the future at Preferred Research Partners to help pharmaceutical companies do the research to develop medications and treatments that are safe and effective for people of all genetic backgrounds.
Erik, can you share with our audience your initial community outreach activities that took place this last week?
Absolutely. I've had the great opportunity to make some connections already with organizations like Synergy Saturdays. It's a great free clinic pop-up that comes around every single weekend. Been doing that for 15 years they have. So made some great connections with them, discussed all the partnerships we can do. I also had the opportunity to meet with the director of the Mexican consulate, as well as other leaders in the community that work really hard to do outreach to the Hispanic community, as well as other minorities here. So already discussing many things that we can try to work together to do.
Yeah. They're excited about the possibility that we can partner with them to enhance healthcare in their communities.
Absolutely. We have certain talents and resources that we can bring to the table. So together with what they have, I think we're going to have some great things coming along down the pipeline.
You know, I look forward to that. It's fun and very rewarding anytime you can reach out to folks and try and give them some new options for their healthcare, right? So. For them and their kids.
Absolutely.
Thank you, Erik, and welcome aboard Preferred Research Partners. So folks, if you or a loved one or a friend knows someone who has symptoms of a gastrointestinal inflammatory disorder or is having difficulty with acid reflux problems and think that they might be interested in exploring the possibility of joining one of our clinical trials, please check out our website, or direct them to our website at www.preferredresearchpartners.com to learn more about these studies. As always, please like, rate, and review my podcast, which helps more people to find it and to learn from the content. If you know someone you think might benefit from viewing this podcast episode, please share it with them. As always, thanks so much for listening to today's presentation on Hope in the Pipeline. We'll see you again next time when I will talk about some exciting new developments in the treatment of post-traumatic stress disorder. Until then, stay safe and stay well.